what you want, when you want it, where you want it. This is The Mesh.
Hello, and welcome to the Caregiver Community. This is a place where we talk about the joys and the challenges of caring for our aging parents and for ourselves. I am Frances Hall. I am founder and executive director of ACAP Community. In today's podcast, we are highlighting the experiences of African American caregivers who represent a range of cultural perspectives. Our guests today are Rosalind Pugh Scott, Public Health Specialist at the Center for Outreach in Alzheimer's, Aging Community Health at A&T University in Greensboro, North Carolina. And we also have Carolyn Thompson, who is a registered nurse with a Bachelor's of Science in Nursing, the Faith Community Nurse with Catawba Valley Health Systems in Hickory, North Carolina. Both of these professionals have worked extensively with caregivers, especially family members caring for their loved ones at home. Hi, Rosalind.
Hi, everyone. How's everyone doing again?
Doing fine. And Carolyn, hello to you.
Hello. How are you today?
Doing fine. This podcast is made possible through a 2018 grant from the Hickory Community Relations Council. The grant project also included audio interviews with caregivers in the Hickory area who represent African American, Latino, and Hmong caregivers and educational materials reflecting this information. Joining me also for the interview is Beth Harris Brandis, who is an ACAP board member who also conducted the interviews as part of the Hickory Community Relations Project. She's the one who actually spearheaded this project. Beth, it's always great to have you here.
Thank you, Frances.
We greatly appreciate each of you being with us today at ACAP as we expand our understanding of unique cultural factors that may impact family dynamics, use of healthcare systems, and end-of-life issues for families in our communities. And I'm going to turn it over to Beth.
Great. Thanks. And we'll start with discussing some issues with Rosalind Pugh Scott. We're delighted to have you with us today.
Thank you. Delighted to be here.
Rosalind, can you first tell us a little about your experience in working with African American family caregivers?
Sure. My first experience started in 2009. I was hired as a family consultant to work with caregivers who were taking care of persons with a Alzheimer's diagnosis in Eastern North Carolina with a program called Project Care. And CARE stands for Caregivers Alternatives to Running on Empty. This program consisted of providing resources, navigating services and support at the local level, as well as it had a respite component attached to it as well.
Great. And so in that, you've led support groups as well as conducted some research with family members whose loved ones have had Alzheimer's diagnosis. Were there recurring themes that you identified in their experiences, specifically as African American family caregivers?
Sure. Several themes, actually. And I'll talk about a few of them. The number one that I found was what I call the superwoman mentality. Because in most African American families, it's the female that's caregiving, whether it's a child or a spouse or another family member. And so is this mentality that I can do all of this. I don't necessarily need support. I can, bring the family in when I think it's necessary, but I got this. I can do this. I can be the mom. I can be the caregiver. I can do all these other things, which, of course, was exhausting to the caregiver, but not always recognizable via the caregiver. Another thing, spirituality, another reoccurring theme. African American families are, big into their churches and their spirituality. They really count on their prayers and, reading of the Word to get them through challenging times, regardless of whether it's caregiving or some other type of family issue. less likely to seek placement. That's something else that I noticed as well. really, focusing on trying to keep that loved one home as long as possible, not necessarily looking to place them, and really not recognizing that they are exhausted and it may be time to place them if there's no other supports available. And there were several others that we had, reoccurring themes. Not really noticing, wrong choice of words, loved ones being diagnosed later in the diagnosis, especially a lot of older adults may not necessarily take to going to the doctor or took to going to the doctor in those immediate early stages. And so there was a tendency to be diagnosed later in the stages of the diagnosis, and also, with being diagnosed later, not seeking resources until later in the diagnosis as well. And so there were several others, like sandwich generation. More than likely, the caregiver is a wife, a husband, and a child taking care of a mom or dad, and possibly still working. So that was a few of the reoccurring things that I noticed in the African American community.
That's really helpful to hear. Did you notice in families that were caring and handling a lot of daily living activities, were there some themes that you saw there that you felt were specific culturally?
Well, in the rural communities, probably more so, because even though I started out in 2009 with 4 counties, I ended up working in all of eastern North Carolina, which is a total of 33 counties. With the ADLs, once again, female caregivers, that superwoman mentality, I can handle this, I can take care of this loved one, even when it came down to the point where they may not be mobile. It's still that strong desire to do as much as you can, as long as you can, not really considering their own health and the consequences of, how that may impact them as well.
Right. So when families began to try to distribute the responsibilities, were there things that you noticed in terms of family dynamics that either promoted coordination of that or inhibited it?
Well, first come, first serve. In the African American family, there really is no structure or format for assigning the responsibilities.
Okay.
In most cases, whomever the primary caregiver is, they may be the person that does it all. They may be, doing the care. They may be handling the finances. They may be driving them to the doctor's appointments. All of those types of things. We had a caregiver conference here last year, and we had a Mr. Brian Pitts, who was named co-anchor of ABC Nightline, African American gentleman, and he had, I think it was he had 3 siblings. He had 2 other siblings, and a host of aunts and uncles and cousins that helped him take care of his mom. And his testimony was amazing to me, because I had never heard of a family so organized in the care of a loved one. And he talked about how each person was assigned a responsibility based on their gifts. An example of that would be like, he was out of the siblings, he was the one they knew made the money because of his occupation. So anything that had to do with finances, he took care of it. His brother was a truck driver, so he took care of, he liked to work with his hands, so he took care of things that were involving the home. In my experience in working in eastern North Carolina, there was not a lot of that type of deciding on who would do what. It was just, you happen to be here, not really focusing on your skills of being able to do it. It's like, you're the primary caregiver, and so you're ending up having to do it. Right.
Well, it might be a good delegation model for some of us to pay attention to as we care for our family.
It was. I mean, I could. It was. I was sitting in the conference with my mouth open as he talked about other, like going to the doctor. He said they would be like 15 deep. And when everybody went with her to the doctor, he had this one uncle that he wasn't a very. He didn't do well in life. He just kind of, was out and about. But his only responsibility was to come and sit with her and watch stories, and that was it.
And that's
he was not to feed her. He was not to give her medication. Not to help her with any ADLs, any of that. His responsibility was to come and watch stories with her, and that was it.
So everyone has a gift to bring back as well, which is a great model there.
Yeah. Most definitely. Most definitely.
You mentioned that often families were late sometimes in seeking medical care. Did you find that families expressed or caregivers expressed positive or negative experiences with the medical community?
And this kind of varied. One of the two things that I think, especially, older adults kind of put their trust in, people or entity, and that's their pastor in the African American community. Number one, their pastor. And number two, if they are going to the doctor, is their doctor.
Mm-hmm. Access issues.
So, the negative experiences, were there. Sometimes it was a race, it felt like it was a race issue. They're not getting the attention, or the doctor is not understanding, that their loved one has this diagnosis. Sometimes it was just, we go to the doctor, he just gives us medication. He don't explain anything. He doesn't tell us anything. He doesn't refer us to any resources. Those negative type of responses. But then there are also those positive ones as well, where caregivers were very pleased with their doctors and how they were communicating, even though there was a lack of knowing what resources were available. They were very happy with the care that they were receiving and the fact that the doctor listened to what they were saying, and also will refer them, if need be, to specialty services. So that kind of varied across the board.
And so in those discussions, were there certain community gaps that you really felt like that we needed to pay more attention to?
Oh, most definitely. One of the things that I'll approach it from two different perspectives. I'll say, I'll look at it from an organization, like the Department of Social Services and the different aging organizations in the community. The gaps that I notice, with the organization is that there's no one-stop shop. There's this piecemealing that has to take place in order to get a service that's going to meet the need of the care recipient and the caregiver from a holistic perspective. Say things like Meals on Wheels, the home and community based services, transportation, housing. I ran into a lot of veterans in Eastern North Carolina because of Goldsboro and Cherry Point. Trying to have a one-stop shop was very complicated and stressful when you'd have to go to you got to go to DSS and you might get served what you're looking for there, or and then you have to go to the Office on Aging to get another service. So a huge gap in how the services are being made available to the caregiver and the care recipients in the community. So that's from that perspective.
And we do hear a lot about that fragmentation and that people don't actually know where to go for assistance.
Mm-hmm. Or where to start. And that's one of the other things, where do I start? That's huge for African Americans. Where do I, who do I talk to? If I talk to this one over here, they refer me to that one over there. Once again, my experience working in the East was a lot of piecemealing, a lot of, one service might be available in this county, but it may not be available in the other county, and also from entity to entity, services not being available for the need of the caregiver and the care recipient as well. Mm-hmm. So my other component in reference to gaps is the caregivers. One thing that I noticed is the lack in knowledge of what this diagnosis means. The lack in knowledge of planning ahead for this diagnosis as well. A huge misunderstanding about what dementia is, what Alzheimer's is. If those who I met that it was early in the stage, they're like, they don't want to think about the possibility of what lies ahead. They just want to live in the moment. And I understand that, but preparation and having a knowledge and an understanding is extremely important to your well-being and your health. And
that's true for the person that they're caring for as well as for the caregiver. And I think it's one of the roles that ACAP has definitely provided in trying to bring people together and thinking together about those issues, for sure.
Uh-huh.
My last question for this part is really to just ask you about end-of-life issues and how much people were willing to talk about those end-of-life issues, and did you learn anything specifically about how you felt that African Americans approached that?
Once again, when we talk about end-of-life issues, African Americans are huge about their spiritual life, prayer and, reading the word and meditation and things like that. The majority of the African American families that I work with, that was their stronghold or their go-to when it comes to end-of-life issues, knowing that, God, they're, of course, using the term, God's going to take care of it, and he's not going to forsake me, and we're going to be okay through our prayer in our spiritual life. But also with that is the lack of wanting to talk about the other type of planning, advanced directives, and like your power of attorneys and your wills, and having that conversation with there may be other siblings, other family members, but having that conversation about what the care recipient really would like their end of life to be like, and of course including them in that conversation. There was a stigma in the African American community about having that conversation, and I think once again that all stems around spirituality. Not wanting to. We don't need to discuss that. When time comes, we'll deal with it at that point. And then, of course, when that time comes, having a lot of broken pieces and not understanding what needs to really happen, because everybody's emotional and making decisions that probably will be in the best interest of the whole situation. But end of life is a conversation that African American families do not like to necessarily discuss in terms of what needs to happen outside of their spiritual life.
Well, that's an extremely important point, and I think it is instructive for us to think about creating context and venues where it becomes more comfortable and accepted to have those conversations and provide the resources. So we thank you so much for bringing that out. We're going to just pause here at this moment and shift over to our conversation with Carolyn, and I'm going to turn this over to my colleague Frances at this point.
Okay.
Thanks, Beth. And thank you, Rosalind. That was some great information. Yes, we want to focus a little bit on some conversation with Carolyn Thompson, who is a faith community nurse here in Hickory, North Carolina. Carolyn, tell us first a little about your work as a faith community nurse in our community. What does that mean? What does that entail?
You might have, again, good afternoon to you. Mm-hmm. You might have heard of faith community nurse termed parish nurse.
Right.
In the past, recently, the name changed faith community nurse because it encompasses communities. Faith community, there has to be a church or a Christian organization involved to, first of all, be a faith community nurse. And I work with a community of churches, so Hickory City at large, Catawba County, and we do lots of preventative care, education, health promotion, just trying to keep people steady at their disease where they are, trying to keep it from progressing if they're already diseased. So lots of education, exercise programs. We do a lot of that. So we do our best to promote health in the faith community. I'm pretty fortunate. I have several churches, therefore I have several pastors that I work with, and believe it or not, each church community, even though they're African American churches, they're all different with different needs.
Sure. But that sort of dovetails with what Rosalind was saying earlier about the importance and the centrality of church and faith community in the African American culture, the African American population. You were part of the Hickory Community Relations Grant Project. And assisted ACAP in conducting the interviews with the African American family caregivers in our community. Can you comment first on just the experience of conducting those interviews? I heard they were so powerful.
Those interviews were very, very powerful. They were strong interviews. You could sense and feel the strength. And I interviewed only ladies. I don't know if there are many men caregivers. I don't know any men caregivers. So all of mine were female and very heart-wrenching. We cried together. We laughed together. There were times when I had to stop the recording just so that the interviewee could gather themselves. It was very, and it was spiritual. It was very spiritual as well.
Yeah. I kept hearing stories about some of those interviews and that they were just so powerful for you all who were listening, but also for those who were sharing their stories. Can you tell us a few of the recurring themes that emerged during the interviews?
Of course, some of what Ms. Rosalind has already stated, but to add to that, even though these families were caring for families, they were fearful. They were fearful of some of the things that they knew about their loved one, but they were also quite fearful of the things that they did not know. I felt, too, that it was overwhelming for them. They felt stressed. They pointed out that they felt lonely. They felt abandoned. So they felt the whole gamut of feelings and emotions that a person could possibly feel who's providing care to a loved one.
And Carolyn, I remember you were talking about how initially family caregivers felt some support even from their church.
Initially, yes.
The daily experience of the repetition and demands really was so stressful because after a while people forget that they are experiencing this daily and caring for their loved one.
Which is interesting because most of these people are part of a faith community. They have been, for their entire life. Once you're no longer attending church, well, people see that you're not there. And initially they said that the faith community was very supportive. But, as time continued to go on, they felt forgotten. Yes.
How sad. Because that's such a grueling experience to be a caregiver day in, day out, or can be. Were there any specific cultural issues that seemed to impact the daily living activities?
Well, just as Ms. Scott, she's already, talked about the Superwoman complex or Superman complex, I guess. But these family members also felt or expected other family members to participate. In the African American culture, that is what happens. A family takes care of a loved one when they become ill. So a lot of them felt abandoned because that part of who they were did not take place. They felt alone, that no one was there to support them. I was pretty fortunate. I interviewed 3 sets of people, but then a 4th set that contained 3 caregivers. I interviewed one lady thinking that she was a stay-at-home caregiver, but she has gone back to work. One who I knew was working, and then one who was a long-distance caregiver. And then I interviewed a family who was caring for their loved one in the mom's home. The 3 sisters live in the mom's home. They all moved back to the mom's home to provide care. And got different experiences from all of them.
So it sounds like a lot of times for those who are really, I'm going to call it in the trenches of caregiving day in, day out, that all too often they feel abandoned by their family, but also from their faith community. And so they feel like they are out here doing this incredibly important but incredibly difficult work all alone.
They spoke to how difficult being a caregiver was, how it takes you away from your normal routine, and how you have to learn to develop a new routine. They're doing something that they've never done before a lot of times, and not knowing how to access the resources. I found that to be a theme as well. Those resources may be there, but not knowing how to access them, and having fear about how to access them, hearing rumors and stories in the community about something such as you can't receive this benefit because they're going to take this thing away from you. Wow. Some people are fearful that their homes will be taken away. So there's lots of fears out there when it comes to accessing community resources. There are lots of fears out there.
Right. So education of what is available, how to access it, what the impact is, would be really important.
Very important.
Yeah.
And also allowing people to understand that these resources are available to every person, regardless of race, creed, color. And I think that is a cultural barrier as well, that a lot of people just don't think that those particular community resources are for me or for my family, because they haven't had access all along.
Right.
Yeah.
Were there any other particular supports that they identified being needed? I mean, that's kind of covering a good waterfront. But
I at the time can't think of any others, but yeah.
One thing that I did hear a lot was that families really wanted the medical community to listen to them.
Absolutely.
They often said that even when we have a large group of our family members in a hospital room, for instance, and there is a family hierarchy, that somebody really needs to be talking with us about who is in charge here and who is making the decisions, and facilitate a broader discussion, because often we feel like our voices are not heard.
Mm-hmm. Absolutely. Absolutely.
Yeah. Are there other pieces of the whole medical experience and medical community that you heard as themes, either positive or really challenging?
Well, I think during the illness, during the acute phase of the illness, the caregivers did not feel that they were that they had a voice, that they were being heard. They did not feel that the doctors supported them in the care of their loved one, so much so that the doctors did not tell them everything. One person I interviewed, her mom was very close to her doctor, and she felt that the doctor was keeping things from the family. And it could be that he and the mom had that discussion that she should be the one to tell. But he would not disclose some pertinent information that they needed to make decisions. So that was a concern for one of the families. The doctors didn't value, they felt that the doctors did not value their input. And even as it relates to emergency medical personnel coming into the home because they've placed a 911 call, they felt that even some of the EMS staff were not listening to what they were telling them about their loved one.
That would make a difficult situation even more difficult. Yeah. Were there issues that surprised or troubled you as the interviewees recounted their experiences?
I think the thing that troubled me the most was that with our community, Hickory is very rich in resources. It troubled me that there's this group of people who had no idea of some of those resources. They didn't know where to start, and they were not pointed in the right direction. That was troubling to me. Being a healthcare professional, it was troubling to me that they were in crises and were not pointed towards some resources.
And Carolyn and I talked about how troubling it was, how totally isolated so many women felt as caregivers, and expressed that to us. And several of them said, I have no life. This is my life. Often they were not only caring for one or two family members, but they were also working one or two other jobs to provide the financial support. And that was palpably painful to us in hearing those stories from the women.
Well, I guess and certainly hope that one of the things that will come from the conversations that you all had, as well as this podcast for people across the nation and the globe, is to begin a conversation about how do we impact change relative to, at minimum, caregivers knowing resources in the community, particularly in populations, in groups that don't know or don't have access or don't know that they have access. I think that is a huge challenge for us, for sure. Carolyn, we've talked some about the medical piece, but what about end of life kinds of issues? What did you find in both your practice as a faith community nurse, but also in these conversations? Were there some issues and some conversation about end of life issues?
Well, I felt too, as Ms. Rosalind stated, that it is very spiritual, and a lot of times the people that I interviewed, they are pretty hesitant to talk about end of life with that care, that person that they're providing the care to. It's a taboo subject to touch. Death is not something that's often talked about in the culture. So they are having difficult times breaching those conversations. But also, one lady that I interviewed, what she does to bring peace to her, because she knows that her mom will die soon, is that she records her mom's voice.
Aww.
She records her voice, and when her mom is pretty lucid, and even when she's not, because she wants to be able to reflect back on that. She doesn't ever want to forget what her mom sounds like. So she does that. That brings peace to her.
Yeah.
And Carolyn, you mentioned several lovely things about the celebration of life in the African American community. Could you comment on that for a moment?
Well, from my experience, and please, Ms. Rosalind, jump in. From my experience, it is usually a ritual of 5 to 7 days where families come over to the home. They bring food, they share meals, and share stories and share memories. Over a period of 5 to 7 days before that funeral will even take place, and I do believe that is pretty cultural.
Yeah, correct.
Okay.
Yeah. And even afterwards too, and the day of, there is a continual fellowship, and maybe 1 or 2 days after that. But yeah, that is the cultural aspect of end of life from that perspective for African American families.
And that is so important. That support at that time is just critical. You all have given such good information. Carolyn, Rosalind, thank you so much for your insight, for your involvement with this, for your insight and time in supporting caregivers. And Beth, thank you for spearheading this really important project and these conversations. We recognize that many caregivers' experiences seem universal, but you both have highlighted, or really you all have highlighted, some experiences and some specific issues that are cultural and certainly that can inform our outreach at ACAP. So thank you for that. Beth, any additional insights, because you too were very much a part of these interviews, any other insights that you have that you'd like to share?
I feel like we just need more venues for people to express their experiences, and it was enlightening, it was emotional, and it was instructive for us in conducting these interviews. And I thank you for the opportunity, and we want to thank the Hickory Community Relations Grant for making it possible.
Absolutely.
And I would like to add too that some of these interviewees would love to participate in support groups, but the time is not there. Right. When would I be able to come? And they themselves did not want to be the ones to start a support group because they did not feel that they could continue that.
Wow.
Rosalind, any other input?
No, I was just listening to what Carolyn was saying. That's pretty interesting. That the desire is there for the support group, but to attend, but not to start one. And maybe it's a matter of having respite. Who would take care of my loved one? Right. If I attended the support group and help me with that. So maybe it's just a matter of having resources that will allow them to attend. And then again, it could be a transportation issue. And I'm looking at this from Eastern North Carolina, which, as Carolyn said earlier, areas are different. I covered 33 counties, and even from one county to the next or one town to the next, things are very different. So, that's great that the desire is there. So How do we fill that gap? How do we fill that need? What is it that we can contribute that would, have them attend?
Right. Absolutely, absolutely. And sort of on that note, it seems to me, because these podcasts are listened to by people across the country and literally across the globe, I look for what is that sort of marching order, if you will. How do we take this beyond this point? For both of you, I guess, Rosalind and Carolyn, is the parish nurse or the faith community nurse, is that a fairly universal position or role in faith communities within an African American culture?
No, not at all. Within the other cultures, yes. There's about 2,000 faith community nurses across the United States.
That's not many.
Not many at all. Not many at all.
Wow.
Yeah.
Wow. And I can, I know, and like I said, once again, in my experience in Eastern North Carolina, I had not come across any parish nurses. Not saying that they were not out there, and the many caregivers I work with in the African American community, I did not encounter any parish nurses at all. And I did Project Care from 2009 through 2017.
Well, Frances, I think there was one other takeaway, too, that I thought in terms of just systems of care, that with our existing mental health systems, we really need to be exploring what people's experiences and family histories are and how that impacts caregiving. Because trauma and difficulties and resentment and family dynamics are heightened in the caregiving experience for families.
Absolutely.
And many things play out again in ways that are surprising, but it's such an intensive experience that all of those things and some of those early losses and hurts come out, and then that ends up causing some friction at times around favorites and financial issues and distribution of resources in the family. So I think that mental health professionals, we can take note of how we should not neglect that area and recognize the impact of early experiences.
Absolutely. Beautifully stated. I will say that one universal organization in every community is the Area Agency on Aging.
Correct.
And I would certainly point all of our listeners to your area, to your regional area agency on aging. And you could find them either by Googling or in a phone book. But in the absence of faith community nurses, that would be a good, at least first stop, I would think, or a place to ask a question, as well as mental health professionals through Department of Human Services, those kinds of entities. But certainly going to your church or your faith community would make a lot of sense.
And that's what I wanted to add when you said the universal organization. The second universal organization in our communities would be the church.
Sure.
It would be the church, and the church is very powerful and could be very instrumental in assisting and helping caregivers to get to the place where they're comfortable, if there is such a thing.
Good.
I wanted to add. Oh, I'm sorry.
No, go right ahead.
No, I wanted to add, to piggyback off Carolyn, here at the Coach Center, and Carolyn is a part of this with her awesome self, we have our Coach Caregiver program that is focused on reaching out to the African American churches, whereas we have a number of churches that we bring for a pastor's breakfast to give the pastors a better understanding of what we're trying to do with our C3, which is to reach out to the church and to provide them with training and education and information on such things as Alzheimer's and caregivers and diabetes and healthy aging for themselves as well as their loved one. And then we ask the pastors to send 2 representatives from their church, and we're having our current, not marketing anything, but just kind of piggybacking, the church is very important, and we realize that in what we do. And so that's most definitely one of the focuses that we have right now here at our center, is to tap into the African American church and to help them or guide them along and being to having the information and the resources available to their members, because even though there may be a health ministry, they may not necessarily tap into the Alzheimer's component, or not necessarily into the caregiver component either. So we just either, we're trying to add on, or we're trying to help them start something new in regards to reaching the congregation about Alzheimer's and caregiving.
Right. And so that's a universal model, really.
Yeah.
And that really is what we're talking about, or what are the models that can be used, replicated in other communities. You all, thank you so much. Beth, Rosalind, Carolyn, and for you listeners, thank you for joining us. This podcast is one of 28 podcasts to date that ACAP offers that address a variety of topics relative to caring for aging parents and their caregivers, you, the caregiver. You may find our other podcasts on the ACAP website at www.acapcommunity.org, or the MESH website, that's www.themesh.tv, or on Apple iTunes. And if you'd like to know more about ACAP or our local chapters in North Carolina and Pennsylvania, with more to come, please visit our website, www.acapcommunity.org, or call us at 877-599-2227. Again, for all of you, thank you for being with us for this important conversation.
Thank you.
You've been listening to The Mesh, an online media network of shows and programs ranging from business to arts, sports to entertainment, music to community. All programs are available on the website as well as through iTunes and YouTube. Check us out online at themesh.tv. Discover other network shows and give us feedback on what you just heard.